Welcome.
Thank you. Good morning, commissioners and the members of public. My name is Jihyun Sakura, and thank you for pronouncing my name pretty well. So, I'm here. I'm a data and research manager at LHSA. By no means, I am not a statistician or epidemiologist. I work for LHSA mainly to.
A little closer to the mic.
Okay. It's a fixed mic. Okay. Is it better? Okay. Now I can hear my voice. Okay. So I work for LHSA, and the big bulk of my team's work is the annual homeless count. And I was invited to talk a little bit about the homeless count, and also kind of focusing on the particular population within the people experiencing homelessness, which is persons living with HIV and AIDS. So I'm gonna go over, first I'm gonna introduce LHSA in case you're not familiar with us, very briefly. And homeless count overview, because it's a very massive task, and I want to kind of cover a little bit of the basics. And then I want to talk a little bit about the demographic survey component of the count, because that determines the prevalence rates in terms of persons living with HIV and AIDS. And then we're going to dive into the data related to this issue. And then we'll have Q&A at the end of the presentation. So, LA Homeless Services Authority is a joint powers authority between the city and the county. So our commission is appointed half by the county and half by the city. And we were created to support, create, and sustain solutions to end homelessness in LA County. And then we are also a lead agency for the LACOC, the Continuum of Care program. It's a funding from the HUD to tackle homeless issue. And just like how the Department of Public Health operates, it covers the entire county minus Long Beach, Pasadena, and Glendale. So they have their own, the continuum of care, and then we operate separately. And homeless count, I wanted to see like who actually had volunteered for homeless count before. Can you raise your hand? Thank you so much for being part of this effort, and I really want to invite you to join the effort this year, which is actually in January 2018. So we recruit about 5,000 volunteers just for the street count, and then overall we have about 8,000 volunteers per year to make this happen. It's really conducted to get a snapshot, the point in time perspective of homelessness in LA. And it also answers some key questions. Who are these people? And where are they? Are they concentrated in a certain part of the county, or are they spread out? And then where are they staying? Are they sleeping out on the street? Are they in shelters? Well, what are their living arrangements? So we try to answer some of these questions as part of the count. And it's a required activity every other year as part of the COC grant. But thanks to the city and the county funding, we actually turned it into an annual count starting in 2016. So it became our annual effort, which is a year-round task. So I mentioned the COC, and it does not include the Long Beach, Pasadena, and Glendale. So the LHSA's homeless count covers the dark blue area only. So those three cities have their own homeless count, but we coordinate together so that we count on the same night to avoid duplications. And then when we say counting, we count basically the entire territory minus private properties. So we cover some metro lines, county parks, riverbeds. We also count in shelters. We also try to enumerate how many folks are staying in shelters on a given night. And it has to happen within the last 10 days of January, and other continuums actually complete this effort within one day. Like one night, they count everybody. But LA County is 4,000 square miles. It's impossible. So HUD actually gave us an exemption. So we split the county into 3 parts, and as you can see, we use SPA as sort of a unit. And that was the sort of timetable for us last year, I mean 2017. And it's going to be slightly different in 2018, but we followed the same sort of SPA kind of split. And we count unsheltered and sheltered persons. I know there's a lot of different definitions around homelessness, but the definition we use here is literal homelessness. So for unsheltered, anybody who's residing in a space where it's not meant to be for human habitation. So street, benches, parks, RVs, vans, cars, tents, makeshift shelters, and things like that. And sheltered population means that they are staying in shelters. So emergency shelters, transitional housing, safe havens, and then the hotel and motel vouchers, the emergency vouchers for people experiencing homelessness. So those are the different definitions that we follow to count homelessness. It's very complicated, but I'm gonna just quickly cover how we break it out. So we have two dimensions. So one is sort of population. We look at adults, adult families, and then youth families and youth. And then we also have shelter status as sort of the second layer, which is by unsheltered and sheltered. So for unsheltered population, for adults, we use the street count component. We also use demographic survey, which I will go into in more details. For transitional age youth, young families, and the minors, we use youth count/survey. So it's a survey-based enumeration that involves extrapolation to estimate the total population, versus the adult count is actually the full enumeration-based count with the demographic survey to estimate population characteristics. So that's kind of a difference in terms of how we count adult versus youth. And then for sheltered population, we just use the same method. So we conduct the shelter count, full enumeration, and the shelter intake survey, which comes from HMIS database. It's client-level administrative data that is collected through outreach workers and providers. So we use that administrative data to understand the demographic characteristics of sheltered population. In terms of our demographic survey, this is really to capture the demographic characteristics of unsheltered adult population. And we do a census tract-based two-stage sampling. So we first look at the probability of selection. And once we determine that, we take it into the next step, which is random sampling. So for any tracts that are not selected with certainty, will be selected on random basis. So we conducted that in January through March, early this year. And we selected about 415 census tracts out of 2160 census tracts. And we could make survey attempts in 387 of them. And then our total eligible cases that we could use for analysis was about 4,800 cases. So I figured that's a good background to kind of give before we go into the details of the data. So the boarding part is done. I'm going to go into the data that you've been waiting for. So I want to first kind of cover sort of like general demographic characteristics of the people experiencing homelessness, and then we're going to zoom into the people living with HIV and AIDS. So you've seen this probably many times on the news. We did experience a huge increase in homelessness between 2016 and 17. About 58,000 people were counted, are experiencing homelessness on a given night. That's a really big number. It's a 23% increase, and this includes all four continuums. So we combined the data from Pasadena, Glendale, and Long Beach, but they're a very small portion of this large population. As you can see, actually the percentage of people sheltered and unsheltered remains the same. So that portion has not changed, but in terms of the volume itself of the homelessness has increased. We also look at the data by communities, and the first thing we look at is by SPA. So service planning areas. A lot of communities experience a pretty drastic increase, and then we've been using this as sort of a starting point to start conversations at SPA level to think about what we should be doing to solve this problem. So that's been going on. I also wanted to highlight our housing placement data. So while there is an increase in homelessness, we also house more people over time. So we housed about 14,000 people during the year of 2016. But it's increasing, but as you can see, we cannot keep up with the increase in overall homelessness. So that's something I wanted to point out. This is the age breakdown of the people experiencing homelessness. I wish I had more breakdown between 25 and 54. Unfortunately, I didn't have it with me today. But the prevalence rate in terms of age ranges has stayed pretty stable over time. In terms of race and ethnicity, as you can see, about 40% of this population is Black African American. And we recognize that that's a gross overrepresentation of African American amongst this population, because the county report, as I recall, said it was about 8.5% in overall population. So it's a very drastic overrepresentation. So actually, LAHSA Commission is establishing an ad hoc committee on African American and homelessness, and they're going to kick off early February. So I just wanted to kind of mention that it kind of triggers some actions coming out of this data point. We also saw a pretty good increase, pretty noticeable increase amongst Hispanic and Latino, and it's still underrepresentation when you compare it to the general population, but we are still kind of keeping track of what's going on within that community so that we can understand why all of a sudden we are seeing these changes. In terms of gender, the county population is almost 50-50 male-female. But if you look here, the male is overrepresented in the homeless population. We also added the sexual orientation data element this year. And then we broke it out by adult and then transition-age youth. As you can see, the transition-age youth tends to report at higher rate in terms of being lesbian or gay or bisexual. And both percentages for adults and TAY are actually higher than the general rates that I've seen in the county report for the general population. So they tend to report this at a higher rate than the general population. So these are some health conditions. These are not the only ones that we include in our analysis, but these are the top 3 ones that we are required to report to HUD. So 30% of people reported that they have serious mental illness. 18% of them mentioned that they have substance use disorder, and then 2% mentioned that they have HIV and AIDS. So there are 2 things I wanted to mention. So I would love to actually hear from this group in terms of what to make out of this data point. That's been sort of a big question mark for us. Like, what does this mean to us? Because so what we heard is that it's self-reported, it may not be reliable. Also, it's a really small population, so blah, blah, blah. So I would love to hear what your thoughts are on this. And also, we sort of noticed a big increase. It's a small population, but the increase is pretty large. So, and one of the things that we changed this year was the way we asked this question. So this is actually the real question from our survey. And then instead of reading this out loud on the street when we are surveying people, we actually had them printed out with numbers for each choices and asked folks to read it and then tell us the number that corresponds to their responses. So we didn't have to verbally ask the question, or they had to verbally confirm which health conditions they had. So we saw the increase in response rates for a lot of these sensitive questions for this, as well as DV, IPV experiences. So that's one of the assumptions that we have, that maybe the response card really helped us kind of capture people who are, because it encourages them to be more candid, because they don't have to kind of verbally confirm or deny. So that's one thought. I would also love to hear what your thoughts are on that too. So we found out that 2 out of 100 people experiencing homelessness over the age of 18 have HIV and AIDS based on the self-reporting. And then I wanted some data reference point. So one thing I found was incidence rate of HIV/AIDS in the county, and it was 24.3 per 100,000 persons. And again, you know, like I would love to hear if there's any better data points out there, whether this makes sense to you all. So this tells me that the rate is much higher amongst the homeless population. And it's a self-reporting, and even if we assume that it's under-reporting, because it's self-reporting, it's still a pretty high rate. Also, we saw that there is a significant increase, like statistically significant increases in persons who have HIV and AIDS in SPOS 4, 7, and 8. So that's the table that contains all the numbers. And then the starred SPOS are the ones with the significant changes. And it looked pretty aligned in terms of the changes when I saw another counter report on the HIV/AIDS and how things have changed by SPOS. So another point that I would love to hear from y'all. I also wanted to kind of include some data to talk about annualized picture. So I mentioned the HMIS, that's a homeless information, homeless management information system. So all the providers are required, all the providers funded through LAHSA are required to use this system to keep track of their clients. So based on that data, about 2% of our clients live with HIV and AIDS. So that's 2,600 out of about 122,000 people. And this is the data from December 1st of 2016 to November 30th of 2017. So it's a very recent data. And then 76% of them are male. And then when we compared to the non-HIV/AIDS clients, it was much higher. So for non-HIV clients, it was 55%. In terms of ages, the 55% were between 35 and 54. And then when you look at the non-HIV clients, they were 33% within the same age range. So I added a little graphic to kind of show you how the age distribution looks so different between the clients living with HIV/AIDS versus the ones who don't. So you will see that the 35 to 44 and 45 to 54 categories are much larger for the clients with HIV and AIDS compared to the counterparts. And I also wanted to highlight some of the shelter programs. I already heard the PLWHA report, so I assume everybody's very familiar with that federal program. But another thing we do as part of the homeless count is creating an inventory of every single provider serving homeless persons or people who were formerly homeless as in a form of supportive housing. So based on that inventory we collected in January, there were about 205 beds for transitional housing. And these are the providers and the programs that we have on our inventory. We had 90 beds for emergency shelters, and then they were all in SPA 4. And 2 out of the 3 programs actually were funded through PLWHA. And then 612 beds for permanent supportive housing. We call them PSH. You will see that there's a variety of programs. I don't see any in SPA 2. But yeah, so that's what we had as of January this year. And then also other permanent housing. These are the housing programs for formerly homeless persons and families without supportive services. And there is 1 in SPA 4. So that's what I have for everyone. And I just wanted to leave you with some resources. So 2017 homeless count, this is really the tip of iceberg that I presented today. There is so much data that we put out there, and then also technical report that you can really dive deeper in terms of our statistical methodology. So you can go online, lahsa.org/homeless-count, and you can get all of that information. And then for 2018 homeless count, you can go to theycountwillyou.org, and you can sign up to volunteer in your neighborhood. So I wanted to leave you with that too. And if you would like to promote for us, you can also get some promotional materials from there for social media. If you have any data requests, you can email us datasupport@lahsa.org. That does not limit, it's not limited to homeless count data. Any homeless related data, you you know, we could be we are a pretty good source in terms of a lot of different questions that you want to answer. So that's a good address to kind of send your questions to, and then we will figure out who can respond. And then in terms of the methodology or anything I presented today, if you have any questions, that's my contact. So that's all from me, and I'll open up for questions and comments.